as far as the healthcare is concerned, is nothing but a challenge. So you see it on TV, you see it on radio every day. Healthcare bill is the biggest challenge in the industry. Now, how does that impact us? Well, it impacts all, you and me. Why? We rolled out Medicaid a few years back. Now we are saying we're going to roll back Medicaid. What it does? Well, what it does to vendors like us is we build tools like charity and we had to roll back. And now it's what happens, we don't know. Another challenge I see in the industry is payment. 10 years back, the payment used to be from the payers. All the products were built around, payment from the payers. Now, all those tools are changing again because 20 to 30% or even more is coming from the patient. So, rightfully said, as there's a book published on this, patient is the new payer. And I agree with that. And we have been all saying that for years. So the products are morphing more and more to get the payment from the patient. Give patient the options to pay. Give patient the way to pay. And same way on the insurance companies. It doesn't mean the insurance goes away. It's just we all have tackled that problems. So where does that leave us today? Well, payers became smart. They have built this thing called authorizations. More and more things need pre-authorizations. So we need to handle those, and that's what we are handling. Similarly, on the patient side, there are a lot more offerings which DCS is doing where we can help the patient pay in time. What else? The company is basically founded on two pillar stones. One is patient experience and one is rev cycle. Now, there are, as I said, there are some cities have 6, 7 hospitals on the same area. How do you stand apart? Patient experience. So you need money, but you need to give the service, and rightfully so. So transparency and experience, and that's what I see as the biggest challenge. So people want value for their money. DCS for years has been looking at the industry, and that's one of our strengths, that to kind of come up with the products and the services which help the customer or the hospital at that time. So today's need, we have a lot of product offerings like pre-authorizations. If you're not getting paid from the payer, we help you with that. Moving your orders, a lot of my clients have different systems, like they will use one hospital, one system on the physician side, totally another system on the hospital side, and they don't talk to each other. Same patient is defined twice in 2 systems. So how do you solve that mystery? It's the same order for same John Doe. It's the same John Doe. It should be the same in both the system, but it's not. That's where we help with single record in both eligibility, patient estimation, and then finally giving him an estimate which is meaningful. That's what we provide to our customers. So patient can view their bill online, they can pay it on time, and if they want to, they can make a payment plan. That's our strength. And we recently, one of the other things we are working on is how if patient can't pay, even with the plan, what alternate measures are available for the payment from the patient. So that's our goal. In a nutshell, we want to again provide the best rev cycle experience, and the patient engagement needs to be at the utmost. That's our goal. That's what we want to provide to our customer.